Hello and welcome to another episode of Laborvision, brought to you by your friends at KDHX, Community Television for St. Louis and beyond. I'm your host, John Hickey, and Congress is right now involved in considering health care reform, and President Obama is very committed to winning health care reform at the national level this year. On today's episode, we'll look at what are some Missourians doing to help make sure we get real health care reform now. Let me introduce our guest to you. First, Bob Soutier, President of the St. Louis Labor Council. Thanks for being with us again, Bob.
You're welcome, John.
Melanie Shouse, healthcare activist here in town. Thanks for being with us, Melanie.
Thanks for inviting me.
And then Dr. Steve Radinsky, retired physician and also active with Missouri
Healthcare for All.
Healthcare for All.
Thank you very much.
Let me start with you, Bob. Healthcare reform is a major priority for the AFL-CIO. Can you tell us why?
Well, sure. Many people ask me, why are the unions concerned with health care? Because all of our members have it. Well, the problem that we have is that there's so many people, there's like 45 million people in this country that don't have it, and it creates problems for everyone. You know, this health care is a right. It's not a privilege, as we see it. And unions have set the tone for workers for years and years and years. You know, everything that workers have today is because of the unions. And we think that it's the right thing to do. People need coverage, and that's why we're so aggressively behind it.
Good. And Melanie, I think your story helps illustrate why Bob's point is so important. Could you give us sort of the one-minute version of your own personal experience with the healthcare system as it is?
Yes, well, I established a small specialty food business, sort of chasing the American dream, and struggling at the beginning, and I was only able to afford catastrophic health insurance coverage with about $8,000 in copays and deductibles. And as a result, I put off and put off and put off getting preventative services and medical screenings and treatments. And eventually I was forced to go in after several years of realizing that there was something wrong, and I had delayed treatment for several years, and eventually in October of 2005 I went straight to Siteman Cancer Center and was diagnosed with breast cancer that had already advanced to stage 4, which the doctors tell you you don't really recover from, and the delay in treatment and diagnosis was the result of my inadequate medical coverage. I've been in chemotherapy for 4 years. I'm on my 3rd round of chemotherapy now, and just continuing to fight the cancer and fight against the big insurance companies at the same time. And
is it, did I read accurately that you were having some back and forth with your insurance company about some new treatment that
yeah, absolutely. I had already undergone 2 rounds of chemotherapy, and but unfortunately this spring I had another recurrence that took me down for about a month, and I was put on a new round of chemotherapy. 2 months after I began my new round of chemotherapy, I received a letter from my insurance company that denied my coverage for that, and I am fortunate that I have the great public health programs Medicare and Medicaid, which are paying for a portion of that chemotherapy, because otherwise I don't know exactly what I would do.
So the private insurance companies refusing to pay for the current treatment that you're getting.
Exactly. It's a case of insurance monopoly bureaucrats coming between a patient and a doctor, which I think is not right and should be ended.
And speaking to the doctor in the house, Steve, I know a lot of people get confused about the healthcare reform debate and are wondering what is the right way to go, but they know that they trust their own personal physician. Last episode of Laborvision, we talked with some local physicians who talked about their support for healthcare reform and the public option. As a physician, what is your perspective on the importance of healthcare reform?
Well, it's very simple for me. Healthcare is a right. It should never be a privilege. It should never be what place in society you are or what happens to you in life. If you lose your job, if you want to retire early and you have a pre-existing condition and you have to keep working, That is completely wrong. We are the only, and I say again, only industrialized nation on this planet that does not take care of all its people, yet we are the richest and wealthiest nation in the world. My reasoning for this goes way back. If you look back at the Old Testament, Leviticus 19, it says we should take care of the sick and the poor. If you listen to Maimonides, he tells you, you should take care of the sick and the poor. Even the Hippocratic oath that I took when I became a doctor said that I will take care of all people, rich or poor, black or white, no matter what, and that's been my creed throughout my practice. I never turned away anybody because they did not have money.
Great. We're going to take a quick break and get back with you, Steve. There you have it. There's 3 local people who are involved in the campaign for healthcare reform and feel this is a time and we all need to be involved.